Melinda, we'll talk a bit more about BPD. We'll go back to that because you are not unhelpable.
Definitely not. And it's just heartbreaking when people feel that way. It's a problem with the language.
And the
when somebody gets
labelling.
told that they have a personality disorder, you know, that's just so innate to your sense of identity. And there's no doubt that for a very long time there was this kind of sense that
It's gendered. It's gendered.
There's a big part of that.
No.
And you know, it does. It gives people a sense that there are very effective treatments for borderline personality disorder. The main one with very good evidence is dialectical behavioural therapy, DBT. But there are other treatments that, you know, can also really help a person look and understand. One of the things with both borderline personality disorder and narcissistic personality disorder, they're both in cluster B, is that it can be a bit of a challenge for some people who are getting included in those labels. And mindful way, you know, how is my behaviour impacting on others?
Kitty cat. When people are disrespecting you and not listening to your boundaries, 1, I've already said no. Why are you continuing? 2, can you explain why you think this is okay after I've asked you to stop? 3, I'm confused. What part of my boundary was unclear? If they continue to do something that you have set a boundary and you are uncomfortable, smack them down.
I'm just coming back.
I'm so sorry the sound keeps coming and going, guys. I have no idea why, what it's doing today. She's a moody little computer, just like I'm a moody little woman.
Yeah, but just to make it clear, I am talking from, you know, my primary role is as a clinician. I'm talking from a clinician's viewpoint, you know, and I've had 20 years experience practicing in various different environments. I'm
just a very deeply, deeply angry ADHD woman. I'm just here for the fun of it. There's a few comments here that we're getting about narcissism, and I actually wanted to talk about this today because it is involved with labeling.
Look, it's
House of Florna Healing. I've been trying to figure out why my cluster B, isn't it?
Self-importance. And, you know,
Need
one of the
for
things when we have a
admiration.
look at the narcissistic behaviours,
Audio muted.
they are not actually that distressed by the experience themselves. Are we back again, and can you hear us now?
Some people have sound and some don't, and I have no idea.
Is our phone on the charger? No, we're on the computer and it's on the charger, so
the laptop's on the charger. I'll take
you.
it off and I'll see if that helps.
Okay. Yeah.
I'll pull that off.
It doesn't cause them any distress. The grandiosity is a big part of what they're experiencing, and that's actually kind of like, you know, it's a pretty good feeling.
Guys,
which makes
please
it very hard to
like the live. It really helps us out.
And one of the differentiations is that, you know, when somebody's kind of feeling inferior or one-downing themselves, they're going to be deeply concerned about their impact on people around them. When narcissism is a big part of the picture, people have a very little concern or interest, and generally their behaviours, impacting on the people around them much more than it's impacting on themselves. But one of the things we were talking about, and it's a really, because it is so talked about at the moment, is just being aware of, you know, when we talk about narcissism or a person being a narcissist, we actually want to bring in some grading, because you can actually have help. You need